Okay. All right. Well, good morning, everyone. Hello, and thank you for joining us here this morning. My name is Reginald Parson, and I'm the Deputy Director with the Maine Paid Family Medical Leave Program. And on behalf of the PFML program, I'd like to welcome you to today's webinar in collaboration with the Maine State Chamber of Commerce. Today's event will be recorded and posted on the department's webpage on Paid Family and Medical Leave. On the call with me is Luke Monahan, Director of the program, Sarah Bryden, our PFML Claims Administration Division Director, and Sophia Khalid, our PFML Policy and Outreach Specialist. I would also like to recognize any members of the Maine Paid Family and Medical Leave Benefits Authority who may be in attendance. Next, I would like to take this time to thank the Maine State Chamber of Commerce for being a partner and working with us to host this webinar. And now I see also Patrick, the CEO of the Chamber, and now I'll hand it off to our friends with the Chamber if they wish to offer any brief remarks.
Well, thank you, Reginald. Do appreciate this collaboration. Since it passed in 2023, the Maine Paid Family Medical Leave Program is one of the largest undertakings for the business community. Uh, One of the most consequential programs for employees and employers alike. It has been a Herculean effort from the staff at the Department of Labor. The timeline has been extremely tight and do appreciate trying to disseminate all the pertinent information so employers can be prepared for as benefits start to roll out later this spring. We're appreciative of trying to disseminate this information in a partnership so Maine businesses can implement this program so employees and employers can meet the statute and the regulations and be prepared for what will be one of the biggest changes in Maine's labor laws. Thank you so much.
Awesome. Thank you, Patrick. Appreciate that. And so before we get into the presentation, just want to remind folks that we'll provide a brief overview of the PFML program with the focus on benefits that will be led by Sarah. And after the overview, we'll also answer any questions. If you have a question as you're listening to the overview, please put your question in the Q&A function on Zoom. And with that, I'm going to pass it off to Sarah to get us started.
Thank you, Reggie. I also just want to express my gratitude to the Chamber for the partnership and making this event available to folks in terms of getting the word out for everybody across the state of Maine. It's super important because, as Patrick said, it's a big change. And so I'm so excited about this opportunity to share more information. Speaking of sharing, I am going to share my screen. Can folks see the PowerPoint presentation? Super, wonderful. And also just a quick audio check. Echoes, no echoes, all good? Okay, wonderful. Okay, so I also I want to be mindful. There's a lot of content, so I'm going to try and get the pacing just right so that our ASL interpreters can do their jobs and so that everybody can understand fully all of this great information and also leave enough time at the end for Q&A like Reggie was talking about. So let's jump in. We are going to spend this hour talking about Maine paid family and medical leave. As most folks here probably already know, benefits begin on May 1 of this year. Very exciting. And there's been events and information rolling out over the last year and change about premium contributions and all that. But now we're so excited to be moving closer and closer to the start of benefits. So at a high level, want to sort of cover what we're going to be talking about in a little bit more granularity as we move through the presentation. Three main areas. So first, I'm going to go over the basics of the law. Again, this might be a reminder and refresher for some folks, but I want to make sure everybody's grounded in a shared understanding of who's covered by the law, what leave reasons are covered, how much time people can take, sort of the the high level basics of the program. Second, I'm going to move into a conversation about AFLAC, which is the company that we have selected as the Maine Paid Family and Medical Leave Administrator. So they're going to do all of the claims administration work on behalf of the Maine PFML Bureau. So we're going to talk about things like how employees are going to apply for leave, an overview of what AFLAC will do then once somebody has applied, and what employers need to know about that process. And then finally, we'll have a quick discussion about some tips, tricks, and best practice recommendations for making sure that you and your company are set up to be as successful as possible. Okay, so Maine Paid Family and Medical Leave 101, the basics. Let's jump right into this part. So the first thing that I want to talk about in terms of, again, making sure everybody has a shared understanding of the law and, what it is and is not. One of the first questions I think that people generally want to know more about is who will be able to take Maine PFML when benefits start in May of 2026. And just a super quick note, because I have heard some questions and confusion about this. When we say benefits start May 1, 2026, what that means is that an absence from work that meets all the other criteria that we're going to talk about here, the absence itself has to occur May 1 or after. So an absence that occurs in April is not a payable absence. If somebody goes out before May 1 but remains out after May 1, the time on or after May 1 of 2026 is potentially an approvable payable Maine paid family and medical leave absence. We are going to be opening for pre-applications before that in April, but just wanted to sort of set that grounding in terms of what we mean when we say benefits begin on May 1. Anyway, so almost all employees in Maine could potentially be able to take Maine paid family and medical leave as long as they meet certain criteria. And so each of these bullet points, we're going to get into more detail in future slides, but just at a high level, somebody would have to meet the earnings requirements to be eligible. They would have to be out of work for a covered leave reason. They would have to provide documentation that they need to be out of work for that covered reason. And they also have to have time left to use under the program. And again, we'll get to, as we go through the presentation, more and more detail. So the other reason why I wanted to start with, who's potentially able to take advantage of this program, the answer is almost all employees in Maine. For folks that are familiar with state paid family and medical leave programs in other states, oftentimes there's a little bit more of a restriction on who's potentially able to take the leave. So minimum employer sizes, you have to have at least X number of employees, or length of service requirements, you have to have worked at a particular employer for a certain amount of time, those sorts of things. The Maine paid family and medical leave program is broadly applicable to a lot of folks in the state of Maine. There are two examples of situations where Maine paid family and medical leave it may be optional. So the first one would be tribal governments in Maine. So a tribal government that is employing people can choose to participate and have their employees covered. And then the other optional category under Maine paid family and medical leave is self-employed individuals. So a self-employed individual can choose to participate, elect coverage, opt into the program, and get coverage in that way. And then finally, on this slide, I want to just quickly point out that there are a few exceptions. So there's some specific types of employment that are not included. So these would be things like federal work study, employees of the federal government, incarcerated workers. And generally speaking, those exception folks would have been identified as part of the process of figuring out who gets included in quarterly wage reporting of data. So just wanted to sort of mention that it's not everybody, it's almost everybody, and give a little bit of context about that. Okay, so we have a number of folks in the state of Maine who may potentially be able to take Maine paid family and medical leave. Um, then a follow-up question that usually comes up right after that is, okay, well, how much time can somebody be approved for? And so the Maine paid family and medical leave law allows an employee, assuming they meet other criteria, to take up to 12 weeks of leave in a 12-month period. And the 12-month period is called a benefit year. It is specifically measured as, if you're looking at an employee who has applied to take Maine paid family and medical leave, the start of their first leave that week, the Sunday of that week, is the start of the benefit year. And then 12 months into the future from that date is the end of the benefit year. So that 12-month period is the amount of time within which a worker who's approved for Maine paid family and medical leave can take up to 12 weeks of time. And I want to note that the phrase up to is doing a lot of work here. So up to does not mean that everybody is going to take 12 weeks of leave. Not everybody's going to need 12 weeks of leave. So some folks might be in a situation where they need a few weeks. Some folks might be in a situation where they do need to use up to 12 weeks of leave. Regardless of how much time somebody is requesting and needing, it does not have to be taken all at once. It can be taken in chunks of time, a few weeks, go back to work, and then maybe have another life situation come up and take another chunk of time. That's a permissible way of taking Maine paid family and medical leave. It can be taken in chunks like that, continuous time. It can also be taken as intermittent leave, which I'm sure many folks are familiar with that phrase, but just to make sure everybody has a full understanding, intermittent leave would be more fragmented time. So, doctor's appointments, things like that, that might be potentially less predictable, and certainly, less large chunks of time taken off from work. Reduced schedule leave is a function of an employee maybe needing to work a shorter work week or a shorter work day, and have that be a repeatable, consistent adjustment to their work arrangement. Specifically around partial days of absence from work for a Maine paid family and medical leave reason. So our program allows for partial days to be taken in 1 hour increments. So the vision is not to take 5 minutes or 17 minutes or any sort of, down to the minute or quarter hour increment. 1 hour is the baseline increment. Additionally, in order to take a partial day of Maine paid family and medical leave, the employee and the employer must agree to the partial day usage of this program. If an employee and an employer don't agree, then the assumption or the vision is that Maine paid family and medical leave would be taken in 1 day increments. If you are reading along on the slide as I'm talking, you'll also you'll have noticed that there's a bullet point I haven't gotten to yet, because that's the one we're going to talk about next. But I wanted to spend a fair amount of time on this concept of how the 12 weeks of Maine paid family and medical leave is intended to run concurrently with other leave entitlements that might be available to workers across the state of Maine. It is not intended to be a 12-week, a bucket of 12 weeks of time that runs in addition. So I'm going to move to the next slide where we're going to dig into this concept even more. So Maine paid family and medical leave is intended to run concurrently with other programs like federal FMLA and Maine FMLA, versus being an additional block of time that's available. So specifically within our rule, there's a provision that says if a worker took unpaid federal FMLA or Maine FMLA in the year leading up to their leave request without Maine PFML running concurrently with that previous leave, then the amount of time they used can be a reduction of their available 12 weeks of Maine paid family and medical leave moving forward. So that's a mouthful. It's relatively complicated. So we have two hypothetical scenarios here on the slide to sort of walk through how this may or may not look. So on the left-hand side, the hypothetical here is Ed employee. Let's say Ed took 2 weeks of leave in February of 2026. Let's say that was approved as federal and Maine FMLA time. It was not approved as Maine paid family and medical leave time because the program, February 2026, it's before the start of the program, so it could not possibly have been approved. And then, so to move that hypothetical forward, let's say Ed then requests 12 weeks of leave starting in July of 2026. That may or may not be approved for federal and Maine FMLA, depending on a variety of factors. But the Maine paid family and medical leave could potentially be approvable for only 10 weeks because those 2 weeks from February would be potentially a reduction against the overall 12 weeks of Maine paid family and medical leave. So then if you go over to the right-hand side of the slide, separate hypothetical, we have Emily employee. And so Emily takes a combined aggregate 2 weeks of sick time in February of 2026. Let's assume for the purposes of this conversation that it is not approvable as federal or Maine FMLA. Maybe she's not eligible, maybe it didn't meet certain criteria. Let's assume it's not approved for any of those three programs. Then let's say that Emily also requests 12 weeks of leave starting in July of 2026. Again, maybe federal FMLA is approved, maybe Maine FMLA is approved. There's a whole bunch of other factors going on there outside the scope of the Maine paid family and medical leave program. But the point here is that the Maine paid family and medical leave 12-week request is potentially approvable for all 12 weeks because there's no, the 2-week federal and Maine FMLA approval in the year leading up to that request is not going to function in the same way as the EDGE situation. So the intent here is to avoid scenarios where an employee might choose to, I'm just going to take my Maine FMLA and my federal FMLA and save the Maine PFML for a separate extended absence. And so the rule has a provision that prevents that from happening. Okay, so another big question that folks have asked about is what reasons employees can take Maine paid family and medical leave for. Several of these reasons will be familiar to folks that are familiar with Maine FMLA and federal FMLA, and there's quite a bit of overlap, but I want to make sure everybody fully understands what this program specifically covers. So bonding leave is one of the reasons that folks will be probably very familiar with. So that would be, for an employee to take time to bond with a new child that they're welcoming to their family, either through childbirth, adoption, or foster care. Caring for a family member. So taking time off because a family member has a serious health condition. Military family leave is intended for folks not because the worker themselves is in the military, but because the worker has a family member who's serving in the military and is going to be deployed. And so then the worker then needs to take time off to deal with certain making arrangements, things like that. For folks that are familiar with federal FMLA, this appears in federal FMLA as qualifying exigency leave. So you may have heard that phrase before. Medical leave, again, very common when a serious health condition prevents the worker themselves from doing their job and needing time away from work for that. And then, so safe leave is not in federal or Maine state FMLA, but that is time to step away from work and seek safety if the employee or a family member of the employee is dealing with a situation of abuse or violence. So I want to go back up through and hit some of these sub-bullet points. If you are reading along, you'll notice that the family member definitions are a little, not all over the place, but they're not the same. So there's a reason for that. So the caring for a family member list of relationships that are covered comes directly from the Maine Paid Family and Medical Leave statute. So if somebody needs Maine paid family and medical leave to care for a family member with a serious health condition, the people that they could potentially take the time to care for are their spouse, their domestic partner, a person they have a significant personal bond with, their or their spouse or domestic partner's child, parent, grandchild, grandparent, or sibling. So that's a relatively expansive list, and that is directly within the law supporting this program. The other ones, so the military family leave, it's a much shorter list. Employees, spouse, child, or parent. That is a shorter list because the Maine Paid Family and Medical Leave law points to federal FMLA for that list of family member relationships. And then the third sub-bullet point, and this is sort of Maine PFML trivia. It's a really, really niche piece of information. So Maine Paid Family and Medical Leave, the law also points to Maine FMLA, which includes the potential for taking leave if an employee's family member is in the military serving in active duty and dies while they're serving in active duty. And so that list is their spouse, domestic partner, parent, sibling, or child. So that's why the family member lists are not exactly identical and tracking all consistently. It's because our law points to federal FMLA and Maine FMLA for those military sub-bullets. Okay, so we've sort of gone over Maine PFML 101. Let's move into a conversation about what AFLAC will be doing as our administrator to support the program and employees and workers across the state. Okay, so if an employee needs to take Maine paid family and medical leave, it's important to note also that what they're going to do to request leave is going to depend on whether they work for a company or an employer that is in the public plan, or if they work for an employer that has a private plan. So as an employer in the state of Maine, if you have a private plan exemption that's currently approved, absolutely, one of the key things that we in the Bureau are trying to spread the message about is the importance of letting your workforce know if you need paid family and medical leave, here is where you go. So letting folks know what administrator, company, carrier, CPA you might be using for your private plan, if that's what's going on for your company. If you go to maine.gov/paid leave, there are some sample notices that you can use for that purpose. If you are in the public plan, there's also, within the maine.gov/paid leave website, if you go to employer resources, there's also a sample notice form for that purpose as well, to let folks know if you need leave, contact AFLAC, public plan. This is the process. So for companies that are using the public plan, employees that need to take leave will contact AFLAC to submit their application. So again, I mentioned at the very top of the presentation that benefits are starting May 1, but we are going to be opening for pre-applications in April. And so once that pre-application process goes live, that will be a portal experience online or a call center experience. So folks that need to interact with AFLAC can go to maine.gov/paid leave once we flip the switch and are live for pre-applications, and there will be a link to get to AFLAC from there. And then AFLAC will also be standing up a call center that will be staffed Monday through Friday, 8 a.m. to 5 p.m. So I also want to make the point that when somebody needs to be out for Maine paid family and medical leave, the expectation is not that they will contact AFLAC and that's it. The intent is not for employers to find out about these leaves because they got a notification from AFLAC. The expectation and the vision is that employees will also be notifying employers. So this should be an open conversation. This should be advance notice. The vision is not for employers to be blindsided. So employees are expected to notify their employer when they know that they're going to be out. For situations, a lot of times, situations are known pretty far in advance. And in those situations, 30 days advance notice is considered reasonable. Of course, sometimes life throws curveballs and, sometimes there's an emergent situation or something that comes as more of a surprise. So in those cases, the expectation is that the employee would let their employer know as soon as feasible. And so this is envisioned to be a written notice. It could be a text, it could be a letter, it could be an email. And it would include information like, the reason why the person needs to take time out of work and the timing. So when are they expecting to need to be out of work and for how long? So the employee has talked to their employer. The employee has gone to AFLAC and submitted an application. So AFLAC is then going to start their claim review process. And just to sort of underscore, AFLAC's administration of the PFML program is intended to both support employees in their application for leave and also take on the administrative burden so that employers are not having to, employers are not going to be dealing with paperwork and eligibility reviews and all that. AFLAC is doing that on behalf of the Maine PFML Bureau for us. So the first thing that AFLAC is going to review is whether the applicant is eligible to take leave. And that is very specifically an earnings requirement as outlined in the law. So it's a certain amount of money that the person earned for work in Maine in a certain time period. The slide here is a little bit dense. I'm going to go through it not as quickly as possible, but at a pretty good clip so that we can get through the rest of the content, but just acknowledging, we're getting into the math here. So the amount is 6 times the state average weekly wage. And as many folks on this call probably already know, state average weekly wage is a number that gets published each year, changes every year. For this year, it's $1,198. Later in 2026, it'll get published at a new number. So 6 times that number is $7,188. And again, that amount of earnings has to have happened within a certain time period. So the time period is called the base period. And it is the first 4 of the last 5 completed calendar quarters before the leave starts. That's a convoluted phrase. It sounds like ridiculously complex, I understand, but it is very intentional. And so I want to talk for a minute about why it's set up that way. So 4 completed calendar quarters, that's a year. So the idea is that the program is going to look at somebody's earnings over a year's time. So if somebody is potentially, a seasonal worker, have other reasons for fluctuating earnings over a period of time, this allows that to get sort of smoothed out and not have situations where, oh, well, what did you earn last month? Or what did you earn, in the last few weeks? This is really looking at what the worker has earned over a year's time. The reason why it's not just the last 4 quarters is because of the way the data is coming into the program and getting used by AFLAC to do this work. So employers across the state have been, since January of last year, sending in their quarterly wage reports and premiums and all of that. So not only has the fund been building up the money from which the benefits will be paid, we've also been collecting that data for the purposes of then checking and seeing, is somebody eligible? And if they're eligible, how much money should they be getting for wage replacement? So because of the way those quarterly reports, those quarterly wage reports come in, the quarter closes, and then there's 30 days to then get the information in. Because of the way that process is working, and the timing of how the data comes in, if it was the last 4 calendar quarters and somebody filed or submitted an application shortly after the close of a calendar quarter, then it's very possible that the last of those 4 quarters, the data might not be there. And we really want to make sure that AFLAC has all of the data that they need to do this, to answer these questions. We want them to have the information at the ready so that they can make accurate, effective decisions in an efficient way without having to reach out and try to get data points that they don't have. So that gap quarter, if we're looking at the last 5 completed calendar quarters, the first 4 are really what's controlling this question. That gap last 5th quarter is a gap quarter intended to make sure that all the data has already arrived so that AFLAC can do what they need to do. So AFLAC's going to use that quarterly wage data, determine eligibility. And the bottom of this slide, I just want to take a moment to explain and make sure everybody is on the same page. So this program is offering a portable benefit to the workers across the state of Maine. And so the wage data that's coming in from all employment in the state of Maine gets reviewed all together. So AFLAC is going to look at whether the person earned that amount of money in the base period, not just at one employer, but at all the Maine employers that they might have been working for, particularly in the public plan. Okay, so let's assume the worker has applied for leave. They are eligible based on the quarterly wage data that AFLAC sort of takes in and reviews. They're eligible. The next question AFLAC is going to ask is, okay, well, has the worker sent in documentation to support their requested leave? So it depends what type of leave, what reason they're taking leave. Again, some of this will be pretty familiar for folks that have a level of familiarity with Maine FMLA and federal FMLA, but just again, to make sure everybody is having a shared understanding here. If a worker needs time off for bonding with a child, then they'll need to send in proof of birth of that child, proof of adoption, proof of foster care placement, could be a birth certificate, could be, paperwork from a hospital after childbirth, things like that. If somebody needs leave to care for a family member, then they'll need to send in a certification form filled out by their family member's healthcare provider, showing that the family member has a serious health condition and needs care. Military family leave, that documentation will look like proof of the worker's family members called to active duty. Medical leave, so somebody needing to take leave because they themselves have a serious health condition, that will be in the form of a certification form completed by their healthcare provider, and it's going to need to show that they have a serious health condition and it's keeping them from doing their job. And then finally, safe leave, and again, that's a worker or their family member experiencing abuse or violence. That's an attestation that they're experiencing an unsafe situation. Okay, so let's assume somebody has applied, they're eligible, they sent in their documentation, and the paid family and medical leave claim can be approved. The next step that AFLAC is going to take is to calculate the wage replacement that that worker should be receiving. Just a quick reminder, Maine paid family and medical leave benefits are intended to be a partial wage replacement, not a full wage replacement. And so AFLAC is going to use the same quarterly wage data that we talked about, the first 4, the last 5 completed calendar quarters that drove the eligibility conversation. Those same data points, that same tally of quarterly wage data is going to be used to determine the employee's average weekly wage. So you take those quarterly wage dollar amounts, add them together, divide by 52, and that's the person's average weekly wage. The average weekly wage then gets run through a relatively complex calculation that's intended to replace the person's average weekly wage at a tiered level. So folks who have earned less in their base period will be getting their wages replaced at a higher percentage versus higher wage earners. And we're going to look more closely at that on the next slide. And at the end of the day, the weekly benefit amount is in all situations capped at a maximum weekly benefit amount, which happens to be equal to the state average weekly wage. So again, we talked about that on a previous slide. That number also serves as the maximum weekly benefit amount. So we have another slide that has quite a bit of math, and I'm just going to talk through it relatively quickly. So the row that says less than half of the state average weekly wage, this is a scenario intended to show what I was talking about with the lower wage earners and the wage replacement effect for them. So if somebody earned $15,600 in their base period, 4 calendar quarters, divide that by 52, and that's an individual's average weekly wage of $300. So the next 2 columns show how the wages get replaced based on how much money somebody earned. So a $300 average weekly wage gets fully replaced at 90%. So that person's weekly benefit amount would be $270. The row below that shows somebody who has a base period earnings tally of $57,000. That divided by 52 is an average weekly wage of $1,096. And then as you move through the grid, you'll see that $599 of that gets replaced at 90%, and then the rest of it gets replaced at 66%. So you add those two and you get a weekly benefit amount of $867. And then the very bottom row on this slide is intended to show a higher wage earner, $90,000 of base period earnings, an average weekly wage of $1,730. Same concept in terms of the next 2 rows, 90% wage replacement, and then the rest of it is 66%. The most important part of this row really, though, is that maximum in the very, very lowest part of the right-hand corner of this slide. So the math for this person would end up at $1,285. However, the maximum weekly benefit amount is $1,198. So that's what they would be receiving. In no situation when benefits go live will anybody be getting a weekly benefit amount that's more than $1,198. So the grid that I just walked through explains how AFLAC is going to get to that weekly benefit amount. And now we're going to talk about some reasons why that weekly benefit amount might be adjusted before it gets paid out. One big reason would be proration for a partial week absence. A partial week absence could look like, 1 or 2 days of intermittent leave in the middle of a 5-day work week. It could also look like, somebody who works 5 days a week and needs to go out of work on a Thursday and then stay out for a few weeks. So that Thursday, Friday start of their leave would be 2 out of the 5 days, so 40% of the weekly benefit amount for that week. There are a couple of situations in the Maine paid family and medical leave law that are required reductions and offsets from the weekly benefit amount. For example, if somebody is receiving workers' compensation or unemployment insurance at the same time as Maine paid family and medical leave, the law requires that the Maine paid family and medical leave benefit get reduced to account for those amounts of either unemployment, workers' compensation as examples. And then also when a worker goes in and applies for Maine paid family and medical leave, they can ask AFLAC to withhold taxes from their benefits. That's completely up to them, but that's a feature of the AFLAC services as well. I want to take a minute and be very super clear about ways that the benefit amount is not going to be reduced or offset. So the program is set up setting aside the proration for weekly absences, potential tax withholding, and the statutorily required reductions, other than those things, the Maine Paid Family and Medical Leave Program is first payer on time out of work for various, coordination of benefits. So if a Maine worker is out for Maine Paid Family and Medical Leave, and they also have a short-term disability insurance policy, or they are going to use their paid time off or other available paid leaves to keep themselves up at the amount of wages that they're used to receiving, those things are not going to be taken out of their Maine PFML benefit amount. So keeping that in mind, it's important to sort of remember that employers are responsible for making sure that employees don't end up, the intent is not that somebody would be taking 40 hours of PTO and then also getting a Maine Paid Family and Medical Leave benefit at the same time. So the idea is that employers are responsible for making sure that the top up is, appropriate. Short-term disability insurance policies, it's up to each employer to figure out how to, either continue those or not continue those. But fundamentally, the Maine Paid Family and Medical Leave Program is not going to be asking, well, what did you get for your other insurance policy? And we're going to reduce that. That's not going to be happening. Okay, so we have we've walked through the eligibility, we've walked through documentation, we've walked through calculation of benefits. I want to take a few minutes and talk about how AFLAC is going to be interacting with both workers and employers once we go live, again, with pre-applications and then, after May 1 with the whole program. So as I mentioned earlier, AFLAC is going to be turning on their employee portal very soon. And when that happens, it's going to be 24/7 online access to create claims, also to add time to claims, ask questions, send in documentation either by uploading. You could upload a PDF, you could upload an image file. You can also send in documentation by fax. They support faxing still. I know a lot of healthcare providers have fax capabilities, and so AFLAC can take in faxes as well, email, and lots of different ways to get your documentation in. Also within the portal, employees can go online and set up their payment preferences. So if a claim gets approved, AFLAC will, in most cases, be able to take that benefit amount and give it to the employee by direct deposit. So an employee can go in, enter their bank account information, and the AFLAC weekly benefit payment process will direct deposit those funds where they need to go. If somebody does not have a bank account or chooses not to provide that information, what AFLAC will do instead will be to put those benefits on a prepaid debit MasterCard and put it in the mail. So if somebody wants to change, if somebody, for example, chose not to provide their bank account information and realizes, oh, I would really rather have direct deposit versus waiting for something to come in the mail with a debit MasterCard, they can log in and update that payment preference at any time. Employees will be able to log in and see correspondence from AFLAC and also change their communication preferences as well. So I would like to be getting letters in the mail versus I would like to be getting electronic notifications, text notifications when something's ready to be viewed, those sorts of things. And AFLAC will also be standing up a customer service support center so that phone line will be open Monday through Friday, 8 a.m. to 5 p.m. And all of this information in terms of getting to the AFLAC folks once it's gone live will be available via our website, the program's website, which again is maine.gov/paid leave. Okay, so now we're going to talk about how AFLAC will be interacting with employers. So again, they're going to have a portal available for online interactions. And again, this will be 24/7. I want to be really like, I want to spend and underline and, double click or whatever the best terms are at the moment to just really highlight the fact that for the purposes of accessing the AFLAC employer portal, employers across the state of Maine will not need a separate login, separate credentials, any of that. What we've set up is single sign-on capability from the Maine paid leave portal that folks have been using for more than a year to do the contributions and the quarterly wage data, all of that stuff that folks are generally more familiar with. There will be a link directly from that existing portal. Click on it, and you will be navigated seamlessly via single sign-on into the AFLAC benefits portal. And so once you're in the AFLAC benefits portal, you'll be able to see which claims have been submitted by your employees, the leave reason, requested dates, the status of those claims, if they've been approved, denied, if they're pending, if they have been canceled. And as an employer, you'll be able to provide information. So whenever a claim gets submitted, one of the first steps is a notification and an opportunity to fill out an employer verification form and just validate the information that AFLAC has. So I did say AFLAC will send you a notification when a claim has been submitted. It's really, really, really important to know that AFLAC will send those notifications by email, and each employer gets to decide what email address those go to. So you may have already seen one of our blast emails about designating your claim contact. So your claim contact is the email address that AFLAC will send those notifications to. You get one per employer company. And in order to designate that, XYZ at, company.com, you need to go into the Maine paid leave contributions portal and designate that claim contact there. Separately, the login access to the AFLAC portal, you can have as many folks as you want, or as your company decides is appropriate. And it's just a matter of making sure that as an employer, you've really talked through and thought through who within our company might need to get into the AFLAC employer portal, making sure that each of those individuals has the access to get into the existing Maine paid leave portal. Okay, so we're at 10:49. I want to make sure that there's enough time for a couple of questions. So we're now going to get to our final segment of the presentation, tips and tricks to make sure that things go as smoothly as possible. So one of the most important things that employers can do to get ready for the program is to make sure that you have a really solid understanding of Maine PFML's undue hardship concept. So again, some folks might be really familiar with other states' paid family and medical leave programs. Ours is unique and different in that it contains this undue hardship concept that I am sure many folks on this call have heard about already. But just generally speaking, what this is all about is it's a provision in our program that allows for potentially rescheduling of leave. So if an employer thinks that a worker has applied for leave and it's potentially going to, based on the nature of the work, the nature of what the person does, the amount of advance notice they've given, based on a number of factors, it's really going to have a significant adverse impact on the operations of that business. The undue hardship provision provides for potentially rescheduling of that leave to a less disruptive time. So the expectation and the vision here is that this would start with a conversation between the employer and the employee. So employers are expected to, have good, strong communication with their employees and, It's also possible that just by, communicating to a worker in writing, hey, this is a really bad time, it's possible that the employee and the employer might be able to simply reschedule the leave before it even gets to AFLAC. If that doesn't happen and the employee applies with AFLAC, the employer can request or can fill out an undue hardship form laying out, all those factors, here's the nature of our business and here's why this would have such a negative impact on our operations, a number of other data points. And so in that case, AFLAC would review that information and review and potentially the outcome might be that the employee's request for leave ends up getting rescheduled to a less disruptive time. It's important to really underscore that the undue hardship concept is not intended to be a mechanism for preventing a worker from taking leave at all. It really is about rescheduling versus denying a leave request. And then finally, the last bullet point on this slide, just to let folks know that one of the things that you can do within the AFLAC employer portal, if it's the right decision for your company, is you can go in and you can indicate that you waive the right to raise an undue hardship concern if you, as a company, have identified just we're never going to, do this. It's entirely optional. It's up to each employer to make a decision about, whether you want to retain the opportunity to say, oh, this is, we would really like to reschedule this person's leave. Or just, if you've decided we're never going to go down that path, you can waive the right to raise the undue hardship provision if you'd rather just, cut down on paperwork and have claims go as quickly as possible. And then finally, just another couple of, quick action steps that employers could do today in advance of everything really going live, just to get ready as early as possible. And this sort of reiterates from a few slides ago, making sure that, you have thought through as an employer who within your company needs to have access to the AFLAC employer portal. And again, those folks need to have access to the Maine paid leave portal that's already up and running for contributions. So you just need to think about that. And then also logging into the existing Maine paid leave portal, designating your claim contact if you haven't already done that, and being aware that that is where notifications will go if and when somebody from your company files a claim. Now, it's important to note that if you do not designate a claim contact, if that field is blank, AFLAC will still send notifications to your company. They will just send them to the login email that was used whenever your company first registered initially. So if that's your CEO or your owner, you might want to designate a claim contact specifically. The other reason to designate a claim contact specifically is because we're going to continue to send reminders and phone calls and, really push to get folks designating their claim contacts. So if you don't want to hear from us, just go in and enter an email address in the claim contact field and we will stop reminding you. And then just a quick reminder that folks can go to maine.gov/paid leave to find a host of information. But one of the things that you'll find there, if you go into the employer resources section, is basically a set of instructions specifically for how to add a claim contact there. You also, I didn't put in the arrow, but required employee notices is on that screen as well. And that's one of the things I talked about earlier in the presentation. We are at 5 minutes left. So Reggie, I will turn it over to you to see if there's any questions that folks are just dying to know more about.
Awesome. Thank you. And I did see in the Q&A if the recording is going to be posted and the slides, the answer is yes. We will do that very shortly. And then we'll send out a note to the interested parties when it's up and running. So yes, so we do have a couple of minutes to spare, and I do have a ton of questions. So the first question is there a waiting period for someone who's given birth to a child?
Yes, thank you. So Yes, there's a waiting period for medical leave. So the first 7 calendar days of medical leave claim are potentially going to be approved but not paid. And then after those 7 calendar days, medical leave is both approvable and payable. The waiting period does not apply to family leave, so bonding, military leave, safe leave.
Awesome. How do we designate a claims contact? So you mentioned it before.
Yeah, I wonder if that
Yeah.
question came in before the last slide.
Yeah, probably. But yes, so there's a way to designate it.
Yep.
So if an employee is receiving workers' comp and PFML, the total benefit amount can exceed the state average weekly wage, right?
Right.
Okay.
Right. So and the weekly benefit amount in that situation, it might calculate as less than the state average weekly wage for sure. And so what would happen is that the amount of the workers' comp benefit would get reduced, and the Maine paid family and medical leave benefit amount would be reduced um, in the amount of the workers' comp benefit.
Okay. Awesome. Is there a grace period before someone starts their PFML benefit?
I assume that that is a question about timing of application.
Mhm.
Yeah. So if somebody knows that they're going to need to be out of work really far in advance, they could apply up to 60 days in advance. But also sometimes, either it's not really clear when you're going to need leave. It might be an emergent or surprise scenario. On the other end, up to 90 days after the start of leave is the length of time that somebody has to submit their application.
Yeah, awesome. So we got this question early on, but a staff member's spouse is due in April, but is not planning to take leave until May. Is it paid?
The answer is maybe. Specifically around the timing, as long as it is on or
Mhm.
after May 1. Of course, there's all the other, variables in terms of are they eligible and have they submitted their documentation and all of those things. But on a timing basis, if it's on or after May 1, it is potentially approvable.
Okay. Um, Kind of switching to like the benefit payments and like other supplemental payments, but how does payments interact with short-term disability to employees when the other supplemental payment is coming from the insurance carrier?
Mm-hmm. So I don't want to speak to what insurance carriers might be doing, other than to say that it's entirely possible that they might have offsetting language in the policy document. So if you had some other company offering and providing short-term disability coverage, then it's possible that they might have a provision that says you need to tell us what you're getting for Maine paid family and medical leave, and we're going to reduce your disability payment to account for that. That may or may not exist in various disability insurance policies. But the important thing to keep in mind is that the Maine paid family and medical leave program is first payer, so will not be accounting for those other potential payments.
Okay, awesome. Switching to taxability, are the benefits taxable by the federal and state government or both?
Mm. So
Sarah, do you want me to take that one?
Go ahead. I was just going to say it's 10:59. That's a bigger answer than that, but yes, go ahead, Luke.
Yeah, so for the purposes of 2027, or excuse me, 2026, PFML benefits, according to the IRS, it's up for the states to decide. Basically, they're not starting their compliance on their new federal taxation rules for public plan employers only until 2027. So in Maine, and this is in our FAQs for employers, we're treating benefits for the state plan as taxable income. That means that employees will receive a 1099-G form at the end of the year for the taxable portion of their benefits as taxable income, but not wages. Starting in 2027, the IRS is going to consider medical leave, medical claim payments, depending on the employer's side, as taxable wages. Our plan right now is that the state is going to hold on to reporting requirements and not pass on liability to the employers. In 2027, we'll announce if we change course on that. So in 2027,
Aflac will also be issuing W-2 forms at the end of the year for the taxable wages portion of medical leave benefits and 1099-G forms for the taxable income portion of family leave benefits. But yes, it's a very moving field right now, federal tax guidance around PFML. We do cover that in our employer FAQs.
Okay. Awesome. And I know we are a little bit over time, but I do want to make sure that we have enough time that folks feel like their questions were answered. So we're going to definitely do that. Just switching to the benefit year, is it defined on a rolling calendar year?
Uh, um, so it for folks that are really in the weeds on federal FMLA, it's essentially rolling forward. So it's that,
Okay.
so whenever the person first takes leave, it's the Sunday of that week, kicks off the benefit year and runs for 12 months forward from that. So then when you get to the end of that 12-month period, if the employee is still out of work, then another 12-month benefit year would start right then. If they're not, so if, at the end of the 12-month benefit year, if the person is back at work and just, no leave whatsoever, then the next benefit year would start when their next leave starts.
Okay. All right. And just so again, we're probably going to end around 11:05 just for the sake of time. And
Yeah.
all right. So what if an employee is only taking 1 hour of FMLA at a time? How can PFML be deducted when it's supposed to be for an entire day?
Yeah. So federal FMLA is entirely separate. So, and it was on some of the slides just in terms of how the programs might interact in certain situations. But at the highest level, federal FMLA runs on its own merits, and that's the responsibility of the employer or whatever, company they might have recruited to handle that. Separately
Okay.
speaking, Maine paid family medical leave, again, can be taken in 1 hour increments if an employer and employee agree. If the employer, for example, says, no, I don't agree to a partial day, then it can be taken in full day increments. So essentially, the employer could say this has to be a full day of paid family and medical leave. Simply saying, no, you can't take leave is not an option, but it must be a full day of paid family and medical leave is at the discretion of the employer.
Okay. All right. So probably have time for a couple more questions, but what age constitutes a new child? If the baby was born in fall of 25, can a parent take leave for 26 in May 26?
Yeah. So the time frame for taking bonding to bond with a new child is very similar to what folks might be familiar with for federal FMLA. So that's 1 year from the child's date of birth or date
Okay.
of placement if it's adoption and foster care. So it's a 1 year window.
Okay. All right. Awesome. And so the last question, and I think you touched on this at some point in the presentation. Just to clarify, does PFML run Sunday through Saturday in terms of the rolling benefit year?
So the benefit year does start on a Sunday just by definition in the
Okay.
statute.
Okay.
I'm not. Can you just read the question again?
Yeah, I know. Yeah, someone just in the chat. So I think they were getting
Okay.
to the benefit year. Does it start on a Sunday or a Saturday? I think they were thinking of the week.
Yeah, so there are some state paid family medical leave programs that specify like how the week operates. And so just at a high level, the idea with the Maine paid family and medical leave program is that as part of the claim submission and intake process, the person's regular scheduled work week will be captured. And then if leave is taken against that schedule, it's a matter of, okay, well, you were expected to work 40 hours. You took 20 hours. That's half of the week. And so the weekly benefit amount would get prorated accordingly. Other state programs operate in a slightly different way that we don't have time to get into right now, but I'm assuming that's where that question was coming from.
Okay. All right, great. Thank you. And yeah, and so unfortunately we are at time, and we really all appreciate you submitting these questions. But again, We will have this PowerPoint slide and recording posted on our webpage very soon. We really want to thank everybody for taking an hour of their day to learn more about paid family medical leave, and I hope everybody has a great rest of the day. Thank you all.
Bye.
Thank you.